One question that patients ask me on a semi-regular basis is whether they can build up a resistance, or rather the systemic infections that they're dealing with, if those microbes can build up a resistance to the herbs that they're working with, if they are working with these antimicrobial herbs for a prolonged period of time, like months or maybe even years in some cases. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. Please talk to your personal health care provider before making any medical decisions for yourself. But for information purposes, it's a really interesting question and interesting topic. We, of course, know a lot about, or hear a lot about antibiotic resistance and maybe viral resistance to different medications. So why wouldn't the same principles be true with herbal antimicrobials? Well, what I can say is that there's a real deficiency of research looking at this. So what I'm saying is really just from my clinical experience and what I've seen. It'd be really nice to see some studies looking at this, but that are not being done to my understanding. But what I can say from clinical experience is that I have had patients over the years where they've needed to work with herbal, systemic antimicrobial herbal formulas on an ongoing basis, sometimes for several months or even, a couple of years in some cases. That's more the exception to the rule. It's kind of on the far end of the bell curve, but it's something that does happen sometimes. And these patients, they'll feel better when they're on their formula, and then when they try to reduce their formula, or they run out, or they forget to take it, or whatever it is, then they start to feel worse, and they go back on it, and they feel better. Or there's other patients where they're feeling better. They are, they taper off of their antimicrobial formula, and then after a few days, weeks, months, or maybe a prolonged period of time, but then there's a relapse for some reason, they go back on the same herbal formula and they start to feel better again. So the same herbs seem to work on an ongoing basis or on a recurring basis, depending on the case in question. So based on that information, or that clinical experience, that leaves me with the sense that the microbes are probably not building up a resistance to those herbs. However, they could be, but just again, from clinical experience, if they were building up a resistance, the herb should stop working in at least some patients, and I really haven't seen that pattern in my practice up to this point. I think one of the reasons why herbs may not be as prone, or maybe they're completely invincible to microbial resistance, is because every batch of herbal formula that we get is going to be a bit different. There are hundreds of different phytochemicals in a given herb. So if I'm recommending, say, a cryptolepis tincture to a patient, well, we know that one of the main ingredients in there is a substance called cryptolepine, and we know that because that's one of the only constituents that's been studied in cryptolepis in terms of its medicinal properties. And so we know about cryptolepine, but how about all the other phytochemicals that are in there? And every batch of cryptolepis tincture that we have is going to be a little bit different because it's always coming from a different plant. Did that plant have more or less sunlight? What was the soil pH wherever that plant was harvested? Was it harvested at a time when there was more or less water that was available? Did the other plants make fun of it when it was growing up? No, just kidding. But there's different traumas that plants can have that they're dealing with. More environmental traumas, and that's going to impact the biochemical composition of that plant. And so I think what makes sense to me is that that biochemical diversity between different batches of plants is going to keep the microbes on their toes enough where they have a really hard time building up a resistance to that particular plant in question. So that's something that I feel that these microbes do not build up a resistance to these herbs, and I really hope that they don't, because it's really handy to be able to say to a patient, hey, here's this formula, and if you need to use it on a recurring basis or on a long-term basis, then we can do that. Another thing that I've observed in practice is that when patients have improved, like there's some improvement in terms of how they're dealing with energy or pain or brain fog or whatever the symptom happens to be while we're treating for these systemic infections, and then they improve but hit a plateau, then a question would be, oh, maybe these herbs aren't effective against some of the members of that some of the individual microbes in this infection, or maybe they built up a resistance to them or something like that. Well, what I found oftentimes is that when we're working with a good combination herbal formula and we're seeing improvements but hit a plateau, and then we think, okay, well, maybe there's resistance or some species aren't susceptible or whatnot, and we start switching up or trying to bring in other herbal compounds. In my experience, it's really rare that that actually moves the needle further in the right direction. So if I have a patient who's on, Cryptolepis and Alcornia and Cedia and Futunia, for example, some of my favorite systemic antimicrobial herbs, and the patient improves and plateaus, if I then bring in formula number 2 with, say, cat's claw and andrographis and Nauclea and Chinese skullcap, the likelihood of adding in these additional novel herbs and making a significant difference is quite low in my experience, suggesting that when we have good systemic antimicrobials, they are good at what they do. And if a patient has improved, plateaued, or maybe didn't improve in the first place, then the likelihood of just other systemic antimicrobials working well, it's just not that likely. Now, to my understanding, the playing field when it comes to pharmaceuticals like antibiotics, different scenario. And I've certainly had patients where they say, oh, I was on, X, Y, or Z antibiotics, and then that seemed to stop working, and then now I switched to these ones, and those ones are working better. That's something that happens semi-regularly, and I think that's because there, of course, is antibiotic resistance that can develop, and just there's no diversity between different batches of antibiotics. One batch of amoxicillin is going to look exactly the same as the next batch of amoxicillin or doxycycline or whatever the antibiotic has to be. So I think that there's less, or rather there's more opportunity for the resistance to build up, and so that might be why it can be very important to have these antibiotic pulsing strategies and things like that to get good results for patients using that type of approach. So I hope that this information was useful and interesting. And if you have any questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.